Welcome back, everybody, to the deep dive. You guys have sent in a ton of stuff on heart health, heart disease, and stroke. So we're going to dive into that today. We know it's super important to you, and well, it's important to us too.
It really is a fascinating area. We're talking about serious conditions, but the thing is, there's actually a lot we can do when it comes to prevention and management.
Right, exactly. And that's kind of like what we want to focus on today. I think most of our listeners are probably familiar with the basics, but just to make sure we're all starting off like on the same page. When we say heart disease, we're talking about a pretty broad range of things, right?
You got it. It's a big umbrella term for, well, anything that affects your heart, really, how it's structured or how well it's working. And the most common type, coronary artery disease, that's CAD. People call it a plumbing issue.
Okay, a plumbing issue.
Well, instead of pipes, we're talking about your arteries, the ones that give your heart muscle all that good blood and oxygen and how they get clogged up.
Ah, I see. It's like plaque buildup, restricting blood flow. So if that flow gets blocked, like completely blocked, that's when we get a heart attack, right?
Yep, that's when you've got a real emergency on your hands.
So then what about stroke? That's got to do with blood flow to the brain.
Yeah.
But there were different types of stroke, right?
Absolutely. Two main types. You've got ischemic stroke. That's where a clot blocks a blood vessel in the brain. And then you've got hemorrhagic stroke. That one's caused by a blood vessel that bursts and starts bleeding into the brain.
And they're both, well, they sound really serious.
They are. Both of those, you need medical attention immediately.
Right. So in both those cases, it sounds like every minute counts.
Every minute. The faster you get treatment for either a heart attack or a stroke, the better your chances are of survival and just, minimizing the damage in the long run.
So those are like the major ones. But I'm seeing a lot of other stuff in here too. This research that you guys sent in. Things like heart failure, arrhythmias, valvular heart disease. It's a lot to keep track of.
Yeah, it can definitely feel overwhelming. So let's break it down a bit. Take heart failure, for example. We're not talking about the heart just stopping completely. It's more like, it's not pumping as well as it should.
So it's still working, but it's kind of struggling. What causes that?
Well, there are a few things that can lead to it. Could be coronary artery disease, high blood pressure, maybe damage from a previous heart attack. Basically, the heart muscle can either weaken and get bigger, or it can stiffen up and then it can't fill properly with blood.
Okay, so a lot of different things can cause it, but they all kind of lead to the same problem. That makes sense. What about arrhythmias? That's another one I always hear, but I'm not sure I totally get it.
Arrhythmia, it's basically when your heart beats irregular. We all get those skipped beats every now and then. But when it gets to be more frequent or really severe, well, that's when you have a problem. It can really mess with your heart's rhythm, and you can have some serious complications from that.
So it's not just about like how strong your heart is. It's also about the rhythm, the timing of it all.
Interesting. What about valvular heart disease? That's one I don't hear about as much.
So this one's all about the valves in your heart. Those valves, they're kind of like gates that control the blood flow between the different chambers. And when they're not working right, that's valvular heart disease. So maybe they don't open all the way. Maybe they don't close properly. It can make the heart work a lot harder to keep the blood flowing.
Gotcha. And then there's congenital heart disease, which I know that means you're born with it. Is that common?
Congenital heart defects happen in about 1% of births each year. And they can be, very different in terms of how serious they are. Some people don't even know they have them till they're adults.
Yeah.
And then others need, surgery or other treatments when they're just babies.
I see. So it really varies a lot. So going back to stroke for a second, we talked about ischemic stroke and a hemorrhagic stroke, but I'm also seeing something here called TIA. What's that? Yeah, TIA, transient ischemic attack. A lot of times people call it a mini stroke, but that can be kind of misleading.
Oh, how so?
Well, you do have similar symptoms, and it is caused by a blockage of blood flow to the brain, just like a stroke. But, and this is important, a TIA usually goes away within 24 hours.
Nice. What's the catch?
Well, a TIA is a big red flag that something's not right with your heart and blood vessels. It actually increases your risk of having a major stroke later on.
So it's not just a weird thing that happened one time. It's something you got to pay attention to. So I think a lot of people are probably wondering what causes all of this, heart disease and stroke. Is it all in our genes, or can we do anything about it?
Well, it's both, really. Your genes definitely play a role, but your lifestyle choices make a huge difference too.
Okay, so let's talk about those lifestyle choices.
Yeah.
Because I think that's where people can start to feel like they have some control, right? And I see all the usual suspects here. High blood pressure, high cholesterol, smoking, and we've all heard about these. But why are they so bad for our hearts?
Well, high blood pressure, for instance, is called the silent killer for a reason. A lot of times you don't even have any symptoms, but over time, that force of your blood against your artery walls, it can really damage them. Makes it more likely you'll get plaque buildup, weakening, even a rupture.
So even if you feel okay, the high blood pressure is still causing problems behind the scenes. What about cholesterol? Isn't there like good cholesterol and bad cholesterol? How does that all work?
Right, there are different types. LDL cholesterol, that's the bad guy, and that's the one that builds up plaque in your arteries. You can think of it like a fatty deposit, slowly making those arteries narrower and narrower, and that restricts blood flow, puts your heart at risk.
Okay, that makes sense. And smoking, I think we all know that one's not good for us. But what exactly is it doing to our heart and blood vessels?
Smoking, well, it messes things up in a few ways. For one thing, it damages the lining of your arteries, makes them kind of sticky, more likely for that plaque to build up. Plus, it increases blood clots, which are a big factor in both heart attacks and strokes. And on top of that,
Well, there's more.
oh yeah, it raises your blood pressure, reduces the good cholesterol, and even makes your blood more likely to clot. So yeah, smoking is definitely something to quit if you want to take care of your heart.
Definitely. So smoking's a big one. What about some of these other lifestyle factors like diabetes, obesity, not getting enough exercise? How do those play into heart health?
So diabetes, that's when your body has trouble controlling your blood sugar. And when those blood sugar levels are high for a long time, they can damage your blood vessels, which increases your risk of heart disease and stroke. As for obesity and not exercising,
Right. What about those?
they both put extra stress on your heart. When you carry around extra weight, it makes your heart work harder to pump blood all over your body. And when you don't exercise, well, that heart muscle weakens. It's not as efficient.
Yeah, that makes sense. Use it or lose it. And what about alcohol and stress? Those can affect your health in general, but what do they do to your heart specifically?
Too much alcohol, definitely not good for your heart. It raises your blood pressure and can damage the heart muscle over time. And stress, well, chronic stress, that can really do a number on your whole cardiovascular system.
It's not just about feeling better mentally, it's about protecting your heart too.
Exactly. When you're stressed, your body releases hormones. And those hormones, they can raise your blood pressure and heart rate. And if that goes on for too long, it can contribute to heart disease.
Okay, so we've talked about all these factors that we can influence. But what about the things we can't control, like our genes or just getting older? If heart disease runs in your family or you're, not getting any younger, does that mean you're like destined for trouble?
Not at all. I mean, yes, those things can increase your risk, but it doesn't mean it's a done deal. Knowing you have that family history, well, it just means you got to be extra careful with those lifestyle choices. And as you get older, it's just even more important to prioritize those heart-healthy habits.
Yeah, it's like if you know you're predisposed, well, that gives you a head start on prevention. So let's dive into some of those preventative measures, because I think this is where people can really start to feel empowered. I mean, we've got a ton of research here, and it actually paints a pretty positive picture.
Right. It is encouraging. Knowledge is power when it comes to your heart. And one of the biggest things you can do is focus on your nutrition.
Okay, so the heart-healthy diet. I got to admit, sometimes it makes me think of like boring salads and giving up all the good stuff. Is it really all about restriction?
Nope. A heart-healthy diet, it shouldn't feel like punishment. It's about finding foods that you enjoy, that you can actually stick with, long term.
So what does that look like? What should we be loading up on?
Think color. Fruits and vegetables, all those vibrant colors, they're full of good things for your heart. Antioxidants, vitamins, minerals, fiber. And go for whole grains instead of refined grains. More nutrients, more fiber that way.
Okay, so brown rice instead of white, whole wheat bread instead of white bread, got it.
Yeah.
What about protein and fats?
Lean protein is the way to go. Fish, poultry without the skin, beans, lentils, tofu, those are all great. And don't be afraid of healthy fats. Avocados, nuts, seeds, olive oil, those are your friends. Those are unsaturated fats, and they can actually help lower that bad cholesterol.
So it's not about cutting out entire food groups. It's about being smarter about what you choose within each group. This feels a lot more doable than I thought.
Exactly. It's all about finding what works for you, something you can enjoy and stick with.
That makes sense. So diet's a big one. What else can we do to keep our hearts happy? What about exercise? I'm not exactly training for a marathon here, so where do you even start?
You don't have to run a marathon to make a difference. The key is finding something you enjoy, something you'll actually do consistently.
So what kind of activities are we talking about?
Walking is a great one. Most people can do that, right? Aim for at least 30 minutes most days of the week. If you want, step it up. You could try swimming, dancing, biking, hiking. Some people love gardening. As long as it gets your heart rate up and your body moving, you're good.
I like that. And it doesn't have to be all or nothing, right? You don't have to go from 0 to 60.
Absolutely. Just start with what you can manage and then slowly increase it, the intensity or how long you do it as you get stronger. And listen to your body. If you're in pain, stop.
So find something you enjoy, be consistent. Okay, that feels less intimidating. What about stress? We talk about how chronic stress is bad for your heart, but stress is kind of like unavoidable these days. How do we manage it?
Well, yeah, stress is part of life, but it's really about how you respond to it. You got to find healthy ways to cope.
Easier said than done, right? Everyone's always like, just relax. But if it were that easy, nobody would be stressed. What are some things that actually work?
Exercise is great for stress relief too. Releases those feel-good chemicals, endorphins. It can lift your mood and make you feel less stressed.
So exercise, the 2-for-1. What else?
Mindfulness practices like meditation or yoga, those have been shown to really help with stress. And even just spending time in nature, hanging out with friends and family, doing things you love, those can all make a difference.
It's about building those stress management techniques into your life, just like you do with exercise and healthy eating.
Right. And don't forget sleep. Getting enough good sleep is so important for your physical and mental health.
Oh, that's a good one. Definitely something I need to work on. Yeah. What about regular checkups? How important are those in the grand scheme of things?
Super important. It's like preventive maintenance for your heart.
So you're catching things early before they become big problems. What do they actually check at those appointments?
Well, they'll check your blood pressure, your cholesterol levels, your blood sugar, all those key indicators. And by keeping track of those numbers and making changes if you need to, whether it's lifestyle changes or maybe medication, you can really lower your risk of those serious heart problems down the road.
Gotcha. So all of this is about prevention for people who are generally healthy. What about people who already have heart disease or have had a stroke? What does managing that look like?
Well, managing a heart condition, that's a multifaceted approach, and it starts with working closely with your doctor. Often that means medication. If you're prescribed meds, you got to take them as directed. That's really important.
So be proactive, follow the doctor's orders. But besides meds, what else can people do?
Even if you already have a heart condition, those heart-healthy habits can still make a huge difference.
So it's never too late to turn things around.
Exactly.
Mhm.
Focus on what you can control. Diet, exercise, stress management, and really pay attention to your body. If you notice any new symptoms or things are getting worse, talk to your doctor right away.
It could literally be a lifesaver to know what to look out for. What about cardiac rehab? I know some people do that after a heart attack or stroke, but I'm not sure what it involves.
Cardiac rehab is a fantastic program. It helps people recover and get stronger after a heart event.
So what happens in cardiac rehab? What kinds of things do you do?
Usually it's a combination of things. Supervised exercise, education on heart-healthy living, some counseling for stress and emotional well-being, and guidance on making those lasting lifestyle changes. It's like a whole support system, a roadmap to recovery.
So it's not just physical, it's the mental and emotional side of things too.
Exactly. It's about giving people the tools and the support to thrive, not just survive, after a heart event. And we can't forget about staying active. A lot of people wonder if it's even safe to exercise after having heart problems, but in many cases, the answer is yes.
So it's not about just sitting around, it's about finding ways to move your body safely.
Right. Of course, talk to your doctor first to figure out what's safe for you. But even something like walking can do wonders for your heart, your mood, your overall well-being.
I'm really struck by how much this is all connected, diet, exercise, stress, sleep, even your mindset. It's all part of the heart health picture.
It really is amazing, isn't it? It just shows you how important it is to take a holistic approach. Look at the whole person, not just one part.
Yeah, it's like this big web, all these things connecting and affecting each other. It's pretty remarkable when you think about it. And it makes you realize that, we're not just along for the ride. We're actually in control, at least to some extent.
Right. We get to decide, what we're putting into our bodies, what kind of lifestyle we're living. It's empowering. And it's not about being perfect. It's about taking those steps, making progress.
Absolutely.
Yeah.
So as we wrap up this deep dive on heart health, what's the one thing you really want people to remember?
I think the biggest takeaway here is that prevention is key. It really is the best medicine. If you understand the risks, you make those heart-healthy choices, and you stay informed, well, you can seriously reduce your chances of having any problems with heart disease or stroke.
Knowledge is power, right?
Right.
Especially when it comes to your heart. And for people who are already dealing with a heart condition, what would you say to them?
I'd say don't lose hope. Work with your doctor, make those lifestyle changes, and most importantly, stay positive. You can still live a good life, a long life. Your body is amazing. It can heal.
That's great to hear. So it's really about taking charge of your own health. As we've been talking about all this research, one thing that really stood out to me was this connection between gut health and heart health.
Oh, yeah, that's a really interesting area.
It is, all those bacteria in our gut, the microbiome, well, it turns out they're pretty important for our overall health. And now some research is saying they could even affect our hearts.
It's true. There's some evidence suggesting that if your gut microbiome is out of balance, it can lead to inflammation and other things that are linked to heart disease.
So that's like a whole other layer to think about,
Yeah.
Another piece of the heart health puzzle.
Yeah, it just goes to show you how connected everything is in our bodies.
Well, I think we've given everyone plenty to think about today.
Definitely. And I just want to encourage everyone listening to keep learning, stay curious, and of course, keep taking care of your heart. It's a journey and it's worth it.
Couldn't agree more. Thanks for joining us for another deep dive. We'll see you guys next time.